Good afternoon. My name is Celia. We are Invita Sens company. We are a group of researchers with 100 years of cumulative experience in immunodiagnostics and sensors. Today my presentation it will be about leishmaniasis. What is leishmaniasis? Leishmaniasis is a parasitic disease that affects people and dogs and usually causes skin lesions, edema, pain, suffering, and when it's not treated can be fatal. The beginning of the infection starts with the infected dog, and the sandfly as the vector bites the infected dogs, and after this bites the people, infecting them. Leishmaniasis is the second highest cause of death after malaria. It is endemic in warmest countries, but due to the climate change, nowadays it is spreading to the north, and nowadays it is possible to find also in the center of Europe. To fight against leishmaniasis, the bodies produce different and specific antibodies into the blood. The actual state of art for leishmania diagnosis are based in kits with only one type of proteins that bind specifically to one type of antibodies, leaving the other antibodies without any connection. And this provides the main drawback that 40% of false results appears due to these antibodies doesn't find any protein to bind them. In this way, the infected dogs, the reservoirs, will be without any control. Our patentable solution, LEVDS, is based on a combination of different types of different combination of proteins, and when the blood is dropped on the surface, all the antibodies that are present in the blood bind specifically, and this will generate a signal that it is quantitative. In this way, we can reduce 10 times the false results. According to WHO, it is really important to control the reservoirs, which are dogs infected with or without clinical signs. And this is where our opportunity starts. We will start with veterinary market. Why? Because to get to the market, it's easier due to regulatory hurdles. It is easier and shorter to have authorizations and certifications. And in that way, we can go faster to the market, and with the revenues that we will have from this project, we can fund other projects like the leishmaniasis kits for humans. The pet dogs market in the world is 223 million of dogs, and in Europe there are 1/4 of these dogs. And Portugal, Spain, and Italy, and France as things that are important for us. The declaration of the disease is mandatory, and also the veterinary care is well developed, and it is an opportunity for our business. We will have, our kit will be based on a dedicated reader and probes. The dedicated reader will be produced by outsourcing, and the probes, it will be produced in our facility. Our final customer, it will be veterinaries, and to get them, we will use two different channels, the direct sales force and the distributors. And to marketing our product, we will do some demonstrations in veterinary schools. We want to do multicentric studies between universities of endemic countries, and also to be present in international meetings. And another important thing is that nowadays we are negotiating with authorities, veterinary authorities, to implement our product in these countries. We have been doing research since 2002 in the development of the combination of proteins and association with these types of antibodies. We are finalizing the proof of concept, and now we are applying to regulatory approvals. And we expect to do we will do the launch in 2017 Portugal, Spain, France and Italy, 1 year later in Brazil. At the same time, with the revenues that we will have from the products from the Europe, we will try to develop and introduce the kit for humans. The introductory kit that we will have, it will be based in a dedicated reader and 50 probes with this price, and our recurring revenues will come from the selling of the probes. We estimate that we will sell 26 million euros after 5 years of launching the product, and this estimation was done based on the adoption rate of our main competitor in the market. And we will have a cash flow in the 5th year of 8.6 million euros, and to do all of these projects we need 2.4 million euros. This is not only the unique product that we have more products. As I told, we are also working in the leishmaniasis kits for humans, and we also have another products for medical treatment. As conclusion, LEVDS enables a reduction from 40% to 1% of false results. In that way, we can control the reservoirs. According to the WHO, it is really important to do that, and in this way, we can save many human lives. Thank you very much for your attention.